Hello, I'm Ken Laidlaw. I'm a clinical psychologist who works with older people, and I specialise in cognitive behaviour therapy, also known as CBT, with older people. We know that a lot of people who, when they become older, face a number of different challenges. It doesn't matter what age you are, you will find these challenges difficult, but they're not impossible. And it doesn't matter what age you are, you can still change and change for the better. And how do they do that? Well, they do it really simply by changing the way they think about problems, sometimes changing their behaviour, and sometimes it's also about changing the relationships with themselves. Sometimes when I work with older people, when I see them, if they have depression or an anxiety disorder, they may have a very negative view of themselves, and they may actually, as they look back over their life, think that they have made a lot of failures or mistakes in their lives. But that sort of attribution is really a symptom of depression or a symptom of anxiety. It's not true. Simply put, thoughts are not facts. It doesn't matter how much we believe that, it doesn't make it any truer. What we do in cognitive behaviour therapy, and we do this with people of any age, whether they're 8 or 80, 9 or 90, we teach people to examine their thoughts. Well, cognitive behaviour therapy is a really simple, pragmatic therapy. It's really about problem solving. Its primary aim is to reduce the symptoms of anxiety and depression, but simply put, the way we think about something affects the way we feel about it, and that affects our behaviour. And if we change the way we think, we can often change the way we feel. Because it actually is a really simple idea. The reality is when we become depressed or anxious, we lose sight of the perspective. And it's hard for ourselves to stand back and look at the way we think about things and say, this isn't always the most helpful way to think about something. So when you see a CBT therapist, that might be how they help you, is to help you to stand back and say, is there an alternative way to think about this? Or is the way that you're thinking about it the only way to think about it? Is there something you could do that would be more helpful for you? A good indicator that you might need someone to talk to, that somebody might be helpful, is when you start to look at the things you do and you are very critical of yourself. That you see yourself as always being at fault in every situation. When it doesn't feel like there's any way out and that things are just going to get better, going to get worse, and it's a downhill slope from here, then that might be the time to seek help, to speak. If you notice that your parents, either your mother or your father, have changed in some way, maybe they've become more shut out. Maybe they've started to isolate themselves. Maybe they seem to be less happy, less joyful than they usually are. If you notice a change in your parents, and it's a change that you've noticed has come on gradually, then you may actually be talking about something like depression. You might be able to suggest to either your mother or father that they should go and speak to someone. If you've got other family members, you could check, do they notice something? If it's your father, you could check if your mother has noticed something as well. If your mother has noticed, she may actually value the opportunity to speak to you. So the thing is, you need to look for the change. If it's a change in state, that's usually an indication that something's happened. I've worked with older people for many years now, as a clinician and as a clinical psychologist, and I've worked with many people who, when I've seen them, have been at a low ebb or felt very vulnerable, And what's always struck me is that the people I work with often will tell themselves that they're weak, that they're no good, that they're not able to do these sort of things that I ask them to do. But at the end, what strikes me is how different their views are. Usually people say, after they've worked with me, do you know what? I know I can do more than I think I could. Or, yeah, now I understand, just take it a day at a time. Or, you know, it's always helpful to get another person's perspective on the matter. So there's lots of different ways and lots of different means in which people can help themselves. And the reality is, I'm not there to be the expert in everything. I'm not there to tell a person to do anything. I'm there simply to help a person try to make some decisions and make some changes. And so any success that people have in terms of the work they do, it's not really because I've done anything. It's really because the person themselves has made the changes. They've done all the hard work. So yeah, there's been lots of success stories. I guess I wouldn't be doing this job if there weren't. But the success stories are not my success stories. They're the success stories of each individual who's had to do something different, who's had to challenge themselves and had to try and make some changes. And it's hard work, but do you see the benefits in people that do that? If you're thinking that your problems are not possible to change, that's the time you should start to seek out help. Speak to a cognitive behaviour therapist, because a cognitive behaviour therapist will work with you to help you make the changes and to bring about a different quality of life for yourself.